Okay, thank you very much. And it's a privilege to be here. I'm sorry for the cameras, but I'm going to move around a little bit. And you're going to appreciate it, because if you make me stay in one place, it's not nearly as exciting. Anyway, I got a question for you. If you go, the next time you go to the doctor for a health checkup, okay, maybe you have your annual physical or whatever it is, you're going to the doctor and you're going to get a checkup. What organ or what thing are you most interested in that the doctor makes sure they check to be sure is working right, is in good shape? And I dare say, right, that almost without fail, every one of you here will say your heart, unless, of course, maybe if you have advancing blindness, you'll say, well, I'm more worried about my eyes. But you see, if you don't have any symptoms, if you're a normal person just sitting here or on the street, the organ that you're most interested in is your heart. My grandpa used to call it his ticker. I want to know my ticker is ticking. And I can understand that. But by the time I get through with this first section of the talk, I'm going to make a presentation, then we're going to have a little 10-minute break for refreshments, and then I'm going to have another continuation and a question and answer period, okay? And during the question and answer, you can ask about anything that you want, but hopefully it'll be something that I know something about. Otherwise, I'll just have to tell you I don't know. So, two hearts. Now, you know probably that heart disease is the #1 killer. There's nothing else that kills more people on the planet than heart disease. And actually, interestingly enough, the people that die from heart disease, if we could have taken their heart a few minutes before they died, that heart muscle is still, in most cases, in great shape. It's a very good heart. But what happened was, something happened to the blood vessels supplying that heart. And so the real problem with heart disease is not the heart muscle, but it's the vessels supplying the blood to that muscle. And here you see a cross-section from a pathological specimen of someone who died of a heart attack. And can you see the outer wall here? This is really how big this vessel is supposed to be. And all this in the middle is supposed to have room for blood flow, but there's a plaque in here, an atheroma. And only thing that was left, so this little tiny clot, that little brown part is a clot. That little clot was able to block this big vessel. And of course, the result was, because this was a large vessel, it killed enough of the heart to kill the person. So one heart resides in your chest. That's the one we all know about. When you say heart, vast majority of human beings think of their chest. Get a little bit more. But this heart, as you know, it beats continually. In fact, did you know that the first thing that you can see in with the naked eye, in a developing fetus or an embryo, even in a chicken egg, the first thing you can see is pulsatile tissue pulsing. And there's no blood yet. And that tissue will fold upon itself and infold and produce a 4-chamber heart. And so the first thing that you can actually see when you were developing in your mother's uterus was your heart tissue. And it's been beating, what does it say, 42 million times a year? You know, if it stops for a few seconds, we pass out. And if it stops for a few minutes, we don't wake up. So you can understand why it gets so much of our attention and why we are so concerned about the heart. Now, there's another heart that resides in the cranium. You remember the scripture, as a man thinketh in his heart, so is he? Not talking about the pump. It's talking about the brain. And in fact, studies are now pretty conclusive that the heart that we're talking about is in the frontal lobes. It's right here behind your forehead. And whereas the chest heart is continually beating, the brain heart is continually making new connections. So Did you ever stop to think about this? That from I saw a little one. Is it Christians? Anyway, I saw someone's very young one here today. And do you realize that from the time that that child goes to a few months old to my age, in their 60s, they'll learn all kinds of information. And especially if you go to medical school, you have to learn a lot of stuff. But my head is the same size, roughly, as the size of that infant. So it didn't get bigger, but it got fuller because the connections. That's how we fill our minds with information, is with new connections. And it's a neural network. If you study into this at all, or if this is your field, you know that the neural network is the most information-dense structure known to man. And it's used, of course, by all kinds. It's not just human beings. Insects have neural networks, too. Not quite as big as ours. So the brain heart is continually making new connections. In fact, 25% of the pump output from the cardiac heart goes to supply the brain. So you could say that perhaps the biggest drain on the chest heart is the brain heart. Now, this medical science is exploring the brain at a fast pace. In fact, right now we're probably learning more about the brain per day than any other organ in the body right now. Did you know, look at that second dot point, did you know that just in the last few months they published the fact that we can now read your words before you speak them with 90% accuracy? They can hook you up with a brain scanning device and with a computer on board, and it can predict a few seconds, milliseconds, not seconds, a few milliseconds before you actually say the word with 90% accuracy what you're going to say. So isn't that interesting? Now, as I say here, you can't read your thoughts yet. Can't read your thoughts yet. And I say yet because I really don't know that sometime we might not get to that point. But what I want to say is that one of the applications about this is that the computer then can do the translation, and so it can detect what word you're going to say and then translate it. And so we might actually get to the point where you could wear something that would translate for you. It's anyway, amazing, isn't it? I don't know if you've ever heard of Phineas Gage, but he had a famous accident. And he worked what we would now call civil engineering. He worked on projects building railroads and roadways. And he had a famous accident with this rod that you see. This picture is a somewhat famous photograph. And everywhere he went after the accident, he carried that. It looks like a rifle, sort of, but it's not. It's a tamping rod, because Phineas Gage's job was to tamp the dirt in after they drilled a hole and put the charge in. I remember when I was a young fella growing up in Virginia, my father was a do-it-yourselfer, and I actually helped tamp the dirt on a dynamite charge that we were going to do some road work. Well, one day the unthinkable happened, and that tamping rod became a missile because the charge went off while he was tamping. And that rod went right up through the part of his head, out the top of his head. Now, you're probably thinking, well, what's that? What's the big deal? Well, do you know that they're still studying Phineas Gage? This is his actual skull. You can see where the rod came out the top. And this is a computer simulation. They're just published in the last month or so. I've got the date here in a second. But they're looking at, because Phineas Gage survived the accident and was physically quite normal. I mean, functionally, he could still use his arms and hands, and etc. And they were looking at this with a computer simulation because they were trying to figure out what were the connections and what was destroyed when this rod went through his head. And why were they trying to figure that out? Oh, here's the date, just this year. And the reason was that Phineas Gage was drastically changed by this accident. It destroyed most of his frontal lobes, and dramatically changed his personality and his character. He went from a fairly hardworking, nice, upstanding fella to a profligate, okay? And for the children in the audience, that means that he became a loose person. And he doesn't, and he ended up going, he went down to South America, actually, and lived on wine, women, and song, as they say. He did come back to the United States. He died actually in San Francisco. So Phineas Gage was our first illustration of the impact of the frontal lobes on character, because the people that knew Phineas Gage said, this is not the same man. This man, you know, he looks like him. Of course, he had one eye. It went, you see, it went right up through his, right through the cheekbone and out through that eye and out through the top. So he lost an eye. He's a nice-looking guy, actually, isn't he? I mean, I think he's a handsome fella. So two hearts, one in the chest, one in the brain. All right. Now I'm sure aware of the amazing heart transplants, right? If there was somebody down at the hospital got somebody else's heart put in their body, it wouldn't even show up in the newspaper. I mean, you know, we do it all the time. It's not even news. So, but it's still remarkable. And if you ever get the chance to observe it actually happening, you should do it. It's really an amazing operation to see how we cut the chest open and spread the rib cage, and you can see then from that point you can actually see this heart beating in there, and then we cut this open, and it's a remarkable thing to watch. You know, they're talking about brain transplants. This is the new frontiers, doing a brain transplant. And I have to admit, I will definitely find a way to go see one of those when they start happening. But I got a question for you. Do you really want to have a brain transplant? You see, if you get a heart transplant, that's a donated heart. But if you get a brain transplant, it's a donated body with somebody else's brain in your body. So do you know, I've been asking this question all over the world, wherever I go, for years, and I haven't found the first person interested in a brain transplant. Because of the two hearts, the cranial heart is actually far more important. And so when I asked you that trick question about going to the doctor to get a checkup, what did you want to make sure was working? I think actually you're more interested in knowing that this brain heart is working properly. Thank you, Daniel. Now, two hearts, but only one killer. Interesting. We saw the vessel here to the cardiac heart, cardiac vessel, and the blockage. Do you realize the same thing happens in the vessels to the brain? In fact, nowadays, we doctors are trying to move away from calling that a stroke to a brain attack. Because it's really the same exact process that happens in the arteries of the heart in the chest happen to the arteries going to the brain. And so to call it a stroke is not as correct probably as to call it a brain attack. I'm putting a few facts together, and then I'm going to tie the knot for you here at the end. But another piece of information, there's about a 90%, it turns out that atherosclerosis, the process that blocks the arteries to the heart, is a systemic disease. If it happens to your heart, it happens elsewhere. Okay, in fact, it's about a 90% correlation when between the size of plaques in the carotid artery and the plaques in the coronary artery. So you know where your carotid artery, right here? And it's real easy for us to measure it with ultrasound because there's no bones in the way, and it's it's right there under the skin. It's a quarter of an inch away from this. So we can really measure the walls of the carotid artery very easily. Now, if we try to do that to the vessels in your heart, we have to go through the rib cage, and as you may know, ultrasound doesn't work well when you try to go through bones. And so we use the carotid artery to predict what's happening in your cardiac arteries. Tell me somewhere else that we're also getting information about? We're getting information about, that's right, the cranial heart vessels too, because it's a systemic condition. So there's a 90% correlation between what's happening in your chest heart arteries and what's happening in your brain heart arteries. Now, two hearts are affected differently when they have blockages. What is the most common symptom of lack of blood flow to the chest heart? I'm sure you know it's pain, right? They say pain in your arm or your jaw. It can be in the back, by the way, over here. So if you get a pain in your back under your shoulder blade and you have had heart disease, you might want to think about it. You could be having anginal pain. But what's the effect in the brain heart? What's the symptoms there? Before you answer, I need to tell you a little story that'll be with me all my life because, you know, I went back to medicine when I was an adult. So I think in some ways it made a deeper impression on me than if I would have been a young person going through medicine. And I can still remember the first time I was in the operating room as a medical student, and we were doing with a neurosurgeon. And the neurosurgeon was quite renowned at Loma Linda for his ability to treat a movement condition. And he would go into the base of the brain with these two probes, and he would destroy a very small amount of brain tissue at the right place, and it was almost like a miracle how it would improve the person's condition. So I was privileged to watch one of those operations, and we put the man to sleep. The anesthesiologist put the man to sleep, and then we cut the little hole in his head. If you've never seen it, it's like a hole saw, and we just put a little hole in his head, and then opened up the dura mater in there, and it doesn't bleed very much inside the scalp bleeds, but inside the bone there's not much bleeding. And then he put the two wires in, and then he, to my amazement, he told the anesthesiologist, "Okay, wake him up." I'm like, he's got a hole in his head, and he's got wires sticking out of it. But anyway, so he woke them up because he needed to be able to have the man move, to see where he was, to get those probes in the right place. And so he started asking him to move, you know, his arm, and he was moving the wires around. And do you know, that guy wasn't yelling in pain. There's no pain inside the dura mater. Inside the lining of the brain, there's no sensors for pain. We could have actually taken a fork and scooped brain tissue out. He wouldn't have felt a thing. I say it a little gross to make the point. There's no pain sensation inside the dura mater. So, the first symptoms of lack of blood flow to the brain is what? The first symptoms actually have been studied by introducing carbon dioxide into the vessels going up to the brain and doing observations. And the first symptoms occur in the frontal lobes. And it's a type of like having a couple of glasses of wine. It just sort of relaxes you, and you just get a little, most people just get a little more loose. You know, you can tell better jokes. I don't know if they're better jokes, but anyway, funnier jokes. And then as we put more and more carbon dioxide in, they get to where they start to have trouble forming memories and making recall and so forth. So the first thing, symptoms are not pain. They're actually symptoms that you would hardly recognize. They might be trouble with resolve. That's a very common one. As you know, I'm sorry to say, but I haven't always been a Christian or an Adventist, and I have personal experience with inebriation, and it does affect your resolve. And so that can be the result of lack of blood flow to the brain. That's what science is telling us. And this is not, we're not making this up. Now, as you're starting, I hope you're starting to think, put the dots together here. So now what we're going to do is talk about one more thing. And that is, when you have a lack of blood flow to the chest heart, how much blockage do you have to be able to tell that you have a problem, that there's a blockage? Well, as you may know, sitting here right now, your heart rate is probably 60, 70, some of you maybe 80. You need to get it down, by the way. But if we had an emergency, the ground shook and the building started, your heart rate could, in a matter of seconds, could double or triple. And so there's a lot of reserve capacity in the blood vessels to the heart, to the chest heart. And so we can only tell that there's a blockage if it's a 70% or greater. You've got so much reserve capacity, we just can't detect it if it's less. So if you have 50% blockage, we really can't tell. You might go to your doctor and you do an exam and say everything's great, keep it up, and you might have a 60% blockage. Now, contrary, the brain heart. Do you know that when you go to sleep at night, that your brain is working just as hard as it is when you're in class? Your brain at night is categorizing and putting information from the hippocampus, the temporary memory, into more permanent memory. It's making connections that are longer lasting, is basically what's happening. And so the blood requirements at night in your brain are almost exactly the same as in the daytime. So there's not really any big change. There's no great reserve capacity. Do you see my point? So we can actually detect a difference in brain function with a blockage as little as 20%. As little as 20% blockage, I think the actual number is about 17%. We can tell that there's changes in the functioning of your brain. But it's not pain, right? Because there's no pain in the brain. All right. Now, I think right there, some of you already made a very interesting observation, and that is my chest heart might seem to be in great shape, but I'm already suffering what? I'm already suffering symptoms in my brain heart, and I may not even realize it. But that's not really God's plan for us to have this problem. This verse right here I'm sharing with you was a life-changing verse for me when I became a Christian. I had been an agnostic, and when I accepted that God was the creator, I decided that I would have the most success in life if I would follow his plan, his design. And so when I read this verse, and God said, "See, I have given you every herb that yields seed, which is on the face of the earth, and every tree whose fruit yields seed to you, it shall be for food," I started eating plants. I started eating fruits and vegetables and nuts. And it's been a real blessing to me. And many of you have made the same decision. Do you know that Harvard has actually studied that verse? No, they didn't study the verse, but they studied what the verse said. They studied in their 85,000 nurses and 40-some thousand doctors and dentists, and they found that every daily serving of fruits and vegetables reduced the risk of coronary heart disease by 4%. In fact, here's the graph for those that like pictures. So for every daily serving of that food that was prescribed by God in Genesis 1:29, we find that there's a reduction in the risk of death from heart disease. By the way, the same reduction happens in the brain heart as it does in the chest heart. And so grains, fruits, nuts, and vegetables prepared in as simple and natural a manner as possible are the most healthful and nourishing. Some of you recognize that. That's one of my favorite books, Ministry of Healing. And that's my prescription. When basically, this is what when I'm treating patients, this is what I'm trying to help them to understand and to apply in a way that fits their life. You know, the Lifestyle Heart Trial was an amazing study published in 1990 and 1998. And what it did was, it was asking, not can lifestyle change prevent heart disease, but can it what? Reverse coronary heart disease. Now, why is that important? Boy, the heat feels really good. I enjoy that it's warm. It doesn't feel good, but I hope it doesn't put too many to sleep. But most of us, even children, I don't know about in Australia, I haven't seen numbers here yet, But in the U.S., we now know that the average high school student in America has heart disease. They already have blockages forming in their arteries of their heart. That's serious. And so that's why it's important to know if you can reverse it, because almost everybody already has it. To just prevent it won't help that many. So we need to know, can I reverse it? So I want you to ask that question and see if this answers it. So this is a randomized trial. This is one of the best study designs we have, randomized trial. And they were going to see if comprehensive lifestyle change could affect atherosclerosis in 1 year. They had 28 patients in the treatment group, and what terrible treatment did they get? They had a low-fat vegetarian diet, smoking cessation, stress management training, and moderate exercise with no medications, actually, in this treatment group. And the other 20, who all of these people, all 48 had disease, these 20 got usual care. And so they got whatever the doctors were using to treat that condition. So now here is a chart I want to show you. This was published in 1998, Journal of American Medical Association, and it's two groups, the control group and the treatment group. And this is the percent change in the blockage. So if it goes down, the blockage is going to get smaller. If it goes up, it's going to get worse, right? So the control group is getting what kind of care? Usual care, normal care, right? So in 5 years, getting usual care, they had a 27.7% increase in the blockage. You know, you don't have to be a non-medical. I want a non-medical person to just think, what is the end point? What is going to happen if this goes on? It's going to kill them, right? It's a heart attack. As the blockages in your heart get worse and worse, you're going to have a heart attack. It's predictable. It's what we call hemodynamically certain. All right, then the treatment group. The treatment group actually in 5 years had almost 8% unblockage. The blockages were getting smaller. So that's why this study, the Lifestyle Heart Trial, was such an amazing study, because it was one of the first ones, or if not the first, to document that you could reverse this condition. And interestingly enough, it was done with lifestyle without any medication. I'm not saying that medications might not have their place, but I'm just pointing out in this particular study they didn't use them. And now I want to contrast that with something. This was from Dr. Esselstyn. He's from the Cleveland Clinic. He's written a book about his work. And here's a Dr. Crow. Dr. Crow is the chief of surgery. I'm forgetting which department it's in. I think it's the cardiac surgery, but anyway, at the Cleveland Clinic. And he had some chest symptoms, and when he went and got an angiogram, they showed this kind of lumpy, bumpy, you can see it barely any opening here in the left anterior descending artery to his heart. He was in bad shape. And this is so extensive that you cannot stent it. He didn't have like just one blockage. He had a huge, long, so they could not use stents. It turns out that he was allergic to statin medicine. He couldn't take statins. But here's his artery 32 months later. And look how nice and clean and clear it is. And what did they treat him with? A plant-based diet without cholesterol-lowering medication. So another beautiful picture showing the reversal. But here's what the problem is. Knowing versus doing, right? Especially for us Adventists, to knowing what to do to have health is only part of our problem. In fact, most of us know something that we would like to be doing better at than we're doing now, including me. But that's a good thing, by the way. You should always be aiming higher. You should always be going forward. But doing it is the bigger part of the problem. Now let's connect the dots. Connect the dots now. What does this mean? It means that we don't need an anatomical transplant of our brain heart. We need an attitudinal transplant. See, I'm not interested, nor are you, in an anatomical transplant. I do not want somebody else's brain. But I do want a transplant. I want an attitudinal transplant. If I could get a transplant that would change my attitude, and do you know that there's a surgeon who specializes in that exact treatment? Read it here with me in Ezekiel. I will give you a new heart and put a new spirit within you. I will take the heart of stone out of your flesh and give you a heart of flesh. This is not talking about the chest heart. If it's not clear, watch here. I will put my spirit within you and cause you to walk in my statutes, and you will keep my judgments and do them. This is a promise. This is a transplant of a heart, the kind that I would be interested in having. You know, I don't know how it is over here, how your coverage is, but in the U.S., it seems like they're always saying, can you hear me? Can you hear me now? What's that? And we can't live without those things, but sometimes you can hardly live with them. But I want to ask you a question. Is it possible that sometimes, because of the blockages to my brain heart, that my Father in heaven is sometimes saying, John, can you hear me? John, can you hear me now? You know the real reason that we're interested in having better circulation to our chest heart and our brain heart is because we want that link with God to be as clear as possible. I want to have the resolve that when my brain convicts me, my cerebrum, the logic convinces me that something is something I should do, I need the strength then to be able to do it. And the conviction needs all the help it can get. And so that's the real reason I believe that you should be interested in knowing about the link between the two hearts in the human body. So the next time I ask you that question about going to the doctor and get your checkup, I hope that you'll realize that, yes, that chest heart is important. But do you know why we will undergo that transplant operation where we take someone else's heart and put it in our chest? I want to suggest to you it's because of the brain heart. It's because we want to keep the blood going to that brain heart. We're willing to throw away the chest heart take somebody else's because we want to keep that brain heart going. So, yeah, this is my little advertisement in here. CHIP is about making better choices. Complete Health Improvement Program. And CHIP actually is effective at helping the religious experience, and I've just shown you the science proving it, because as it promotes better circulation to the frontal lobes of the brain, it makes us a better citizen and a better Christian. So, I'm actually not supposed to take questions and answers right now. Right now, we're going to do a break. Yeah, right there it is. And I want you to take a break and get up and move about. And when you come back in about 10 minutes, I will continue with the next section, which is much shorter, and then we'll have the questions and answers.